Welcome to DC to Be Revolution. I'm Noah Volz. This is where I help chiropractic students think big in order to live large. Today, I'm here with Dr. Stephen Perle, and he teaches clinical science at the University of Bridgeport. But before that, he was kind of the original sports chiropractor. He started in New York City, and he was the medical director for the U.S. high school indoor track and field, the U.S. cross country, and the U.S. outdoor track and field championships, among many others. He's currently also the North American representative for the Fédération Internationale de Chiropractique du Sport. So, Dr. Stephen, thanks for being here.
My pleasure. Nice to speak with you.
Yeah, likewise. So I wanted to go way back to 1991 when you really started getting well known in sports chiropractic and working with, these professional teams and Olympic teams. And I feel like in a way you paved the way for Dr. Bill Moreau, who works with the Olympic team in Rio, which is, I think he's the first medical director to do that. I was going
to say, at least for USOC, he's the first one.
Yeah, at least for USOC.
Yeah.
Yeah. And so over that span of time, how have you, seen chiropractic's role change and morph, and what are kind of the, how has it changed for better or worse sports chiropractic, in the bigger scheme of things?
Well, actually, I should fix the timeline a little bit. We'll call 91 more to the pinnacle, and then 91 is when I transitioned into being an academic. So my real move into sports chiropractic in New York started I started practicing in '83 in New York City, and '85 is when I decided to really sort of push into sports chiropractic. I have a background as an athletic trainer in high school and college. I was actually my high school's first athletic trainer. I basically practiced medicine without a license starting at age 14. I'm not sure what the statute of limitations are, so I won't tell you what state that was. But the difference has been really profound. I mean, yeah, as you noted, Bill Moreau with USOC. I mean, when I was in chiropractic college, I remember watching a 60 Minutes piece about chiropractic in the Olympics. So it must have been 60 Minutes in 80, 81, something along those lines. And USOC was completely opposed to any relationship whatsoever with chiropractors. They weren't going to do anything at all. And I think at this point in time, I've had 4 or 5 of my former students who have gone to do a internship at the Olympic Training Center. One of my former students was one of the 2 chiropractors working with USA Track and Field at the Rio Games. And so, the fact that they actually took 2 chiropractors with USA Track and Field was a big deal, because again, at one time, USOC took 1 chiropractor with the Olympic team, and they wouldn't allow the individual national governing bodies to bring their own doctors. I mean, they came in not credentialed as doctors; they came in sometimes credentialed as managers. So, the change in that time has been really, really profound. And same thing with how many professional teams you see having some chiropractor as a consultant, where, again, at one time, players, say in the NFL or NBA or Major League Baseball, we're seeing chiropractors on the side and couldn't tell the team or the team trainer about it, where now a large chunk of those teams have chiropractors that they have contracts with who work as the team chiropractor and see those athletes on the up and up instead of behind the stadium, so to speak.
Yeah, you mentioned, a couple of your students getting the opportunity to intern or work at the Olympic Training Center. As a student myself, interested in possibly moving in the direction of sports chiropractic, what do you feel like was different about those students, or what do you feel like separated those students from other students and gave them that opportunity?
Well, I think one thing is, if you look at any student in any field of endeavor, there's sort of 3 basic types of students. There are deep learners, there's strategic learners, and there's surface learners. And you know the surface learners, they're the ones who don't do well at all. The strategic learners get A's, but they don't remember anything. And, you know, they forget it all by the time the test is over. And then the deep learners are the ones who actually learn the material that's being taught and can incorporate it and use it. And so the first thing I'd say is that every single one of them was a deep learner. The second thing is I think they were goal-oriented and that they wanted to really get into sports chiropractic. Although one of them, I'll say, was somewhat accidental. And I think in it, the good model, which was given to me by one of my friends who did work with USOC, is there's definitely accidents. And if I talk about, you know, my career with track and field and long distance racing, there were accidents all along the way that sort of turned in my favor. But as one of my friends said, a way to think about the luck or the accidents is, I'll use a baseball metaphor, you know, getting up to bat at the bottom of the seventh inning in the World Series, where your teams are tied. It's the last game in the series. Sorry, in the bottom of the ninth inning, your teams are tied. There's 2 men out. The bases are loaded, and your team is down by 3 runs. Being the person who comes up to bat, that's all luck. But winning the World Series, winning grand slam, you know, walk-off grand slam, that's skill. And so luck might get you in those positions. But if you don't perform and you don't do what people expect of you, you're not going anywhere. So, you know, luck is good. And luck can be who you know, who your relatives are, where your office is, that your next door neighbor happens to be involved in some team, or you stumble upon the right patient. Those are all luck. But you still got to be able to do the job. And you figure as a sports chiropractor, there's really 3 jobs. The one job is treating injuries. Another job is trying to help prevent injuries. And then the last job is trying to improve athletic performance. And if you can't do all 3 of those jobs, at least in the minds of the athlete, then, you know, all the luck in the world won't get you anywhere.
Yeah, I want to dig into those 3 components just a little bit more, because, you know, what I think is really unique and interesting about you is you've really seen this kind of trajectory in sports chiropractic, maybe over the last 20 years, or even longer. And so, you know, what do you feel like are some of the biggest advances in terms of qualitative improvement in each of those different categories? What is different about how sports chiropractors are working with athletes today than it was, you know, in the 80s when you first started?
Well, you know, one thing, of course, is, I'll say, new technologies, whether it's kinesiology tape, whether it's using instrument-assisted soft tissue mobilization or pin and stretch, those kinds of therapeutic interventions. That's clearly new things that have come about than there were when I was practicing in the late 80s. The changing attitude is an important thing. I think the changing attitude on the chiropractic side of the equation is also important. That, you know, our profession has played this game separate but distinct, and separate but distinct makes you not a team player. And the thing you have to be in a sports medicine environment is you've got to be a team player. And you can't be, well, I'm the chiropractor, I'll tape the ankles, I'll do this, I'll do that. You've got to have respect for the people and all the roles that they play. So, you know, if somebody's doing a CCSP, part of what happens in the CCSP program is explaining what the roles are. You're doing on-field coverage and there's an athletic trainer. You don't go on the field until the trainer calls you. It's their job to triage. And that's the same if you're an MD also. The trainer's the captain of the team, and they pick out the parts of the team they need to work. And so you've got to learn how to work in the team. I've been at track meets where I'm it. And, you know, I'll do the first aid. I've done it since I was 14. And I'll tape the ankles and I'll do all that. But if we say U.S. Track and Field Championships in '91, I had a staff of 350. And in my staff were chiropractors, chiropractic students, paramedics, sports psychologists, dentists, podiatrists, MDs, PAs, athletic trainers, massage therapists. And, you know, in that environment, did I tape an ankle? Not once. Did I do trans restriction massage on someone? Not once. You know, I would take a wax pencil, draw an X, draw an arrow this way and that way, and say to the massage therapist, do this, call me when you're done, and let me go check and see how that muscle is at that point in time. And so, you know, one of those things that I think USOC looks at is, are you a team player? Track and field in New York, I became a certified track official because I'd go to an event where, I mean, I could have a choice. I could stand there with my hands in my pockets for 2 hours because nobody got hurt, or I could also maybe help time a race because they didn't have enough people. But also as a certified official, I knew when I could provide assistance and not disqualify an athlete versus when I would do something that would disqualify an athlete. So meet management, you know, loved me because I understood the meet inside and out. And I was part of the team.
Yeah, I mean, that's perfect. And I feel like that's what really makes you unique, is that, you know, not only from like the sports chiropractic side being the director, but also, you know, from the research side and everything you've done with the University of Bridgeport. I feel like you have this unique skill set where you're able to really compare and evaluate all the different treatment options that are out there and choose one that you feel like is going to be the most effective for that individual, whether that's an athlete or whoever that may be. You know, what do you feel like is kind of chiropractic's role in that, or where do we, you know, if people want to get into sports chiropractic, where do we fit into that bigger umbrella of a team?
It all depends on how comprehensive the team is, and so you don't want to step on other people's toes, and you want to be respectful of them just like you want them to be respectful of you. I practicing in New York, I met this, really, I'd call him the grandfather of sports podiatry, and I was in his office. I spent a half a day in his office just to see what he did before I started sending patients to him. And he tells me about a chiropractor who calls him up, newly practiced in New York. This is 86 or so. And the guy says, do you mind if I call you up and consult with you? And the podiatrist said, no, sure, that's fine. And he says, yeah, like, because, you know, when I make my own orthotics, sometimes I need to, modify them after the patient's used them for a bit, and I'd like to talk to you about how I should modify them. And the podiatrist said, not a problem. I'd be more than happy to help you with that. If you didn't mind if I called you up and asked you about what's the best way to adjust one of my patient's lumbar spines. You know, because I've been doing that in my office too. And so, you know, you have to be the team player in that. But I want to cycle back to something you said about the research. And as a researcher, you know, we have a growing body of evidence that what we do can be effective for certain conditions, but there are a lot of places where we don't have it. You know, on the issue of improving sports performance, we have a real paucity of evidence, and that needs a lot of work. And in fact, I also chair the International Federation of Sports Chiropractic. Your pronunciation on the French was actually reasonably good. Fédération Internationale de Chiropractique de Sport. You don't say those final consonants, sport, not sportif, or sportive. Yeah. But you know, the Research Commission, you know, we're really hoping to get more people who are really interested in doing those things. But you know, part of, I think, what sports chiropractors have done is taken these things in a very pragmatic approach. And I'm going to use a personal example, although I think the science of one is the science of none, but it explains how an evidence-based chiropractor could use something with not a lot of evidence. Now, one of my colleagues told me that another colleague was using hyaluronic acid as an oral supplement, and the person who was telling me is my age, a faculty member here, and the person he's talking about is in his 80s, and had a lot of pain from how he was using his hands, having been a chiropractor for 56 years, or 58 years. And I knew he had pain in his hands, but he'd been taking this and the pain went away. Now that's purely an anecdote. So what I did was I went to PubMed, I put in hyaluronic acid, And I looked up the randomized clinical trials, and none of them were really robust. It is rather low-level evidence, and it's equivocal. Some studies say that it's effective. Some studies said it wasn't effective. So I can't say from an evidence-based standpoint, I've got a strong body of evidence to support using it. But the bottle cost me $15 for a month of treatment. If it doesn't work, the downside risk is I spend $15 and maybe my urine or maybe my feces is a little bit more expensive and worth more than it had been otherwise. There's really no downside risk to it outside of that $15. And the upside is that maybe it works. So I have retropatellar pain in my knees, and it's diminished dramatically. Now, could that be placebo effect? Sure. $15 could be a placebo. It's $15 out of my pocket. That's a couple less Frappa Macchiato at Starbucks. Or it could be effective. And I think that's the thing with treating the athlete, that most sports chiropractors are very performance oriented. So last national championships I work at, I'm treating this high jumper who has pain in her knee at takeoff. And it's when she plants and twists. And she tells me where it is. And I say to her, well, is there anything you can do right in front of me right now that reproduces the symptoms? And what she does is she sort of like shimmies her knees around, and she says, that does it. I said, okay, great. So now I go feel what I can feel in the muscles. And I think I find, some muscles that I'll say this doesn't feel so good to me, the tension in the muscle. And so I do some pin and stretch in that. And I go spring the joints in and around her knee, the joint above, the joint below, see if any of those provoke pain, because I think the evidence is pretty good that we can't feel joint motion, or what we perceive to be joint motion probably isn't accurate. So I spring the joint and see if any of those provoke pain. And when they do, I do an adjustment, the manipulation there. And then I say, get off the table and try it again. And so she does the knee little shimmy thing, and she says, oh, that's all better. And I say, great, go jump. And she says, wait, let me try this again. And now she does it standing on one leg and shimmies around the one leg. I mean, I don't know how she did that. When I demonstrated, I've got to hold on to do that. And she says, well, it still hurts a little bit over here. And so I direct my approach on muscles a little bit more related to where she says it hurts again. And then she gets up and she says, no, that's fine. And I said, okay, go jump and, try a few jumps, and it's still bothering you, come back and see me. And if that's placebo, that's okay. And if it was therapeutically effective, that's okay. And so it's very performance oriented kind of treatment.
Yeah, I wanted to touch on that just a little bit. You mentioned the research and, your work with FICS. And so, in terms of students coming out of school, wanting to work in sports chiropractic, recognizing that there is this need for more research, there is this need for higher quality research. What recommendations would you have for students getting involved with FICS, or how can we as young people advance that overall field?
That's a great question. Now I'm a full-time academic, and I also work in clinic in student clinics. So I see patients 2 hours a day every day, but when I was a student, I went to Texas Chiropractic College. We got a brand new radiologist who actually now is at Logan College. And, I had to do I did some assisting in radiology, basically because I'm horrible at it. I figured it was a way to try and get a little better if I had to spend more time with it. And I was asking him about what he did as a chiropractor. Do you adjust patients or see patients? And he said, no. And I just thought that was so bizarre. I thought, well, wait, you're a chiropractor. What you're supposed to do is see patients. And, I'm sure all of the students watching this have DACBRs at their schools who probably never see patients. And it was, I had a very limited viewpoint of what about a chiropractic career might be. And so some people might say, you know, what I want to do is go off and be a sports chiropractor, and we can talk about those ways to deal with it. But relative to the issue of research, someone might say, you know, I really think it'd be good to contribute to the body of evidence and help deal with sports chiropractic. You know, I think it's cool to do that, but I've got questions in my head and I like to do that. And I think that the answer is, while you're a student, whoever's doing research on your campus, you know, our institution, we don't have a research department. Everybody has to do research or they're not going to get tenure. So identify, you know, faculty members on campus who are doing research and volunteer, and then you get an idea, do you really like the research endeavor? And then if you do, then the thing to look at is getting, you know, real research training, which master's program, maybe transitioning into a PhD after that, and that would be the way to really contribute on the research side. If the issue is, you know, how do you get started, you know, in sports chiropractic, one is getting training, and I think it's improving your skills at biomechanics, at looking at people biomechanically, at learning how to adjust the extremities, learning different soft tissue techniques, and then I think you've got to be willing to put in the sweat equity and the time and to volunteer. I think I say, one, you should pick sports you love, but don't get married. You know, because if you ask me in '85, when I started working with long distance road runners, what's the sport I love, it would have been football. You know, I got started as an athletic trainer in football, and there's nothing I like better than dealing with contact sports and that kind of thing. Well, in Manhattan, there's not a lot of high school football teams, and I stumbled upon track and field, or actually long distance road racing, and then that also, I stumbled upon track and field through that, and so I didn't get married to football. It was where I wanted to start, and then went from there. I think opportunity knocks, but too often people don't answer the door. And the example of opportunity for me was my wife and dad and I were painting my office, and a guy I knew told me, you know, he invited me to come to his hotel room. He was coming into New York, and he was going to treat what at the time was the top American marathoner. And he said, why don't you come and observe? And I said, well, I could probably come and help treat people. And the reality is, I abandoned my dad and my wife. And, you know, that's an example of an opportunity that knocked that I probably should have said no to from from my family standpoint. But from the business standpoint, both my dad and wife realized that this was probably an opportunity that was knocking that I should do. And in fact, that coach is the person who put me in almost every position there was. You know, that was you know, my up at home plate at the bottom of the ninth inning event. And one of those athletes I treated that night was my Grand Slam winning, you know, World Series winning Grand Slam. So you got to be willing to do that, and you can't be so high and mighty that you won't fold towels if that's what the medical team needs, or, you know, do massage even though I'm not a massage therapist if that's what the medical team needs, and, you know, be consistent. The first year I started working with the New York Roadrunners Club, I probably worked at 60 long distance road races, and I'm talking about 10 degrees outside and snowing, you know, 33 degrees outside and raining. It didn't matter. I was there every weekend, which also became a marketing point because every chiropractor says they deal with athletes. And I know my patients would say to one of their friends, you know, go see Dr. Perle, and he's a sports chiropractor. And it's like, yeah, every chiropractor is a sports chiropractor. And they say, yeah, see, we just crossed the finish line and it's freezing outside. There he is. He has a complete commitment to track and field. And that became essentially a marketing thing that everybody knew. I was a long distance, you know, internationally, you call track and field, long distance running, and race walking is called athletics. That's the name of the sport. And so, you know, not that they would use it, but they could say, look, he's committed to athletics, not just dabbling in a little sports medicine.
Yeah, you know, you've mentioned a few things here that I just kind of wanted to recap. You know, initially you mentioned like the deep work, you know, in terms of a student really diving deep into the material, really owning the material and how important that is. And then also you mentioned like, you know, your analogy here with the World Series and like, you know, luck and skill. And so, you know, you had this bit of luck when you were painting, but you had the skills to actually like capitalize on that. And so I, you know, without getting yourself in trouble, because you are an educator, you do teach at the University of Bridgeport. Like, what do you feel like it needs to happen in chiropractic education in order to allow students to develop the skills through opportunities? Because it seems like that's kind of the core piece.
Well, I mean, that's an interesting question, because if you were to ask my students who've done the time at USOC, a lot of the core things that they needed to do with athletes, I taught them. You know, I teach a lot of postgraduate work, and I almost teach nothing in a postgraduate way that I don't teach here at the university. You know, I'm doing a lecture this weekend for the state of New Jersey, and it's what I teach every day here at the university. You know, I did one a month ago in Minnesota. It's what I teach here every day at the university. And I haven't taught in a CCSP program for a while, but when I have, except for specialized topics like on, you know, acute death in an athletic environment, when it came to diagnosis and treatment, it was all things that I teach here at the university. I did a lecture for the Rehab Council a couple weeks ago, and really everything I taught was what I teach here at the university. So, you know, if you look at chiropractic education, you know, you guys who are graduating today, what you're learning is dramatically different than what I learned. You know, I think I got a great education at Texas Chiropractic College. I have no complaints in hindsight whatsoever, but I teach almost nothing they taught me. And I think understanding the nature of education, you know, getting a degree in history isn't to get you to memorize dates. Getting a degree in science isn't to, you know, and say physics isn't getting you to memorize F equals MA. Getting a degree in chiropractic isn't getting you to actually remember, you know, learning how to do a piezoform push. It is really to learn how to think like a historian. It's to think like a physicist, and it's to think like a chiropractor and have a certain basic set of skills that you can build upon to practice as a chiropractor. And if you have that, then getting the next set of skills is easy. And so I think TCC taught me how to think like a chiropractor. So when new things came along, I was able to incorporate that within how I did things. But you know, to really have the skills with athletes, I think to expect that would be, you know, what really is termed undergraduate chiropractic education, what you get in a DC degree, it is a mistake. You know, I did do a CCSP, which was sort of the be-all, end-all at that point in time, and I used to serve on the American Chiropractic Board of Sports Physicians that gave out the CCSP. You know, so today I'd say getting a CCSP and getting a diplomate would be the thing. And what I think it's going to be tomorrow, and the not too distant tomorrow, is that everybody's going to do a 2 or 3 year residency. You see right now, VA has 1 year residency programs. University of Bridgeport has, I think right now it's 4 or 5 students who are in full-time residencies in orthopedics is what it is. It's musculoskeletal medicine at community health centers here in Connecticut, and we're expanding that beyond that, where people are full-time residents working for 3 years. We have a maturing profession, and at one time we thought 18 months of education gave you everything you needed to know to become a competent chiropractor. Now we think it's, I don't know, quarter systems, what are people like 12 quarters or 9 trimesters? We're on a semester base. That really isn't everything you need to know to be able to practice, particularly to practice within a specialty. So you've got to get more training.
Yeah, thank you for that. And I know that, students, other chiropractors who are watching this are going to want to develop those clinical skills and do that additional training, and perhaps are going to want to communicate with you about what your recommendations are in terms of that additional training. So what's the best way to get in touch with you? And if you have kind of any recommendations right off the bat in terms of that additional training for people to do so they don't have to reach out to you, what would you recommend?
Well, from a training standpoint, CCSP is definitely one way. FICS, the International Chiropractic Sports Federation, has the ICCSP, and those courses tend to be outside of North America. The Canadians have their own education program for sports chiropractors, so that's one place to look for that. I want to make one plug on a standpoint of finding the evidence is Greg Kawchuk, who chairs the Research Council for the World Federation of Chiropractic, Mike Schneider, who's at the University of Pittsburgh, and I from FICS put together, with the help of a lot of other colleagues, but it was our initial work, something called the WFC Suggested Reading List. It's WFCSuggestedReadingList.com. And basically within a variety of different domains, let's say neck pain, extremities, low back pain, discussion about stroke and side effects from manipulation, there are lists of 10 papers that are the best ones that we call them curators have come up with and said, these are the 10 that you want to look at as sort of a starting point. So I want to make a plug for that. It's free. Not all the papers are there. If they're free full text, they're there, but otherwise we're obviously not going to violate copyright. If people want to get in touch with me, really the best way is going to be by email or Twitter. Twitter, I'm at smperle, and Perle is Perle. Email is Perle, again, Perle, at bridgeport.edu. That's the best way. And I'm more, email is probably better than anything else. And I'm more than happy to respond to anybody's questions.
Perfect. Thank you. And thank you for mentioning that website. I know that I've been there and looked at some of the free papers on there and found that invaluable in terms of making evidence-informed decisions for, the people that I'm working with in clinic here. So yeah, thanks for mentioning that. This has been a production of DC to Be Revolution, helping chiropractic students think big in order to live large. If you enjoyed this video, please consider subscribing to the channel, leaving some comments below. Would love to hear from you. And thank you once again, Dr. Stephen Perle, for being with me.
My pleasure. Have a great day.